Bismillahirrahmanirrahim. In this video, we will discuss the mycology MCQs. Person went to the Thailand and present with the diarrhea, which is the watery and largest amount. Stool sample is a donut shape. Where found is a cryptosporidium. Okay, most common opportunistic infection in a patient with the HIV is the Candida. The chronic fungal infection with the rhinosinusitis causing the medial erosion and the granulomas is by the aspergillosis. ठीक है, rhinosinusitis किसकी वजह से होता है? Mostly aspergillosis की वजह से. Patient is having the rhino with the fungus, having the lamina papyracea, excessive endothelial damage organism is the mucormycosis. ठीक है, अगर तो उसने rhinosinusitis के साथ इन्वेसिव एंडोथीलियल डैमेज ऑर्गेनिज्म है तो क्या होगा? Mucormycosis. HIV patient presented with a fever, neck rigidity, meningeal irritation site. Which organism is likely responsible for the cryptococcus? Okay, so a patient undergoes a renal transplant. He is on the immunosuppressive therapy and develop the angular cheilitis. Causing the agent is the Candida albicans. And the इसमें देखो patient undergo the renal transplant. He's on the immunosuppressive therapy and develop the angular cheilitis causative. Angular cheilitis is the Candida albicans. Child prone to systemic candidiasis is the immunosuppressant. So the AIDS opportunistic mostly causes the diarrhea is the cryptospordia. During the third trimester of the pregnancy, vaginal infection usually occur with the following organism is the Candida albicans. Okay, so a patient went to Thailand on a return presented with a diarrhea which is the watery and large in amount in the stool sample, donut shape and the cyst and the halo around the organism is the cryptosporidiosis. One of the following fungus act by the involvement of the reticuloendothelial system is the histoplasma. Okay, and farmer in the shortness of breath came to the clinic on chest x-ray. Physician found the coalian, but could be the cause is the aspergillus. Okay, and the female of 34-year came to with a complaint of the high blood sugar level, shortness of the breath and the fruity odor smell. Decay is associated with which of the following infection is the mucor? Okay, the serology test for the aspergillosis will be the galactoman. HIV patient presented with a fever, neck rigidity, meningeal irritation, hollow seen around the organism is the cryptococcus neoforms. Okay, rhinosinusitis है, एंडोथीलियल डैमेज में अभी ऊपर ही हमने देखा था, मैंने आपको क्या बताया था? म्यूकर. Person with a difficulty in the swallowing, there was some white growth inside the esophagus with a pseudo hyphae, like the reason is the candidiasis. Okay, and आपने याद रखना है डीके है हो, इसके अलावा राइनोसाइनोसाइटिस हो, ब्लड वेसल को इन्वेट करे वो म्यूकोराइजोपस आता है. एस्पेजुलस जो है वो नॉन डायबिटिक है, इम्यूनो कम्प्रोमाइज है, राइनोसाइनोसाइटिस है और सेप्टेट हाइफी. कैंडिडा में सूडो हाइफी होते हैं. क्रिप्टोकोकस के अंदर मेनिंजाइटिस और एनकाफ्लाइटिस में याद रखोगे हिस्टोप्लाज्मोसिस जो है वो रेटिकुलो एंडोथीलियल को इन्वॉल्व करते हैं. ग्रैनुलोमा विद द सेपरेशन कॉज बाय द नोकार्डिया फंगस. यंग मेल विद द हिस्ट्री ऑफ द एथलेट फुट, राइट साइड प्रेजेंटेड विद द राइट फुट एंड द लेग राइट. Red hot to touch and the painful is afebrile, has an inguinal lymphadenopathy. Indurated illness that are spreading up cause is the Streptococcus pyogenes. 79-year-old man with a renal transplant 2 years back now presented with a complicated pneumonia, not responsible. So the boot-shaped cyst, the organism causing the condition is the pneumocystic durovecii. Okay, so organism involved the oral thrush is the Candida. Red granules prostrating abscess from the foot organism responsible is the actinomedura. Okay, so the cryptococcus neoforms can be visualized by the Indian ink stain. Patient having the 15 centimeter mass and compact granuloma without necrosis will be the aspergillosis. Most common fungal infection in the AIDS will be the Candida. So, cysticercosis caused by which of these? Ingestion of the ova of the Taenia solium. Cryptococcus neoforms can be caused by the Indian ink stain. The yeast species that are resistant to echinococcus is the Candida auris. Whitish discharge from the vaginal cause is the Candida. Non-diabetic female having the chronic rhinosinusitis develop the fungal infection that show the septate hyphae at the acute angle and producing the respiratory symptoms. Most likely fungus will be the aspergillus. Okay, so admit for the surgery, complain of the dry mouth and the examination where white patches on the mouth, difficult to eat, swallow, but should be the myconazole. Okay, so white vaginal discharge जो है वो किस वजह से होता है? गोनोरिया, सॉरी कैंडिडा. वाइटिश डिस्चार्ज हमेशा कैंडिडा की वजह से होता है. हिस्टोप्लाज्मोसिस मोस्ट कॉमनली इन्वॉल्व ऑर्गन सिस्टम इज द CNS. Okay, so HIV patient presented with a fever, neck rigidity, meningeal irritation, and the hollow around the organism is the Cryptococcus neoforms. With the difficulty in the swallowing, there was a white growth inside the esophagus with the pseudo hypha is the candidiasis. Okay, and now we'll discuss the parasitology. Patient presented with the paroxysmal fever, chills, and the time duration for the symptom appearing was 35 to 48 or ring with a crescent shaped organism. Most likely is the plasmodium फेल्सीपेरम. जब भी क्रीसेंट शेप की बात होगी ना, आपने फेल्सीपेरम को याद रखना है. 5 year old child प्रेजेंट विद द रेक्टल प्रोलैप्स ऑर्गेनिज्म रिस्पॉन्सिबल फॉर द रेक्टल प्रोलैप्स के लिए आपने हमेशा से ट्राइकोरस ट्राइकोरा याद रखना है, ठीक है, और मसल्स के लिए ट्राइकेना याद रखना है, रेस्पिरेटरी सिस्टम के लिए एस्केरियसिस. Patient with abdominal pain, sudden headache, fever, and the chill. He is also having the splenomegaly, hepatomegaly. Organism responsible for this, the stain positive, which organism is likely is the Cryptococcus. Squamous cell carcinoma is in the person who came from Dubai and presented with a painless hematuria. Likely organism associated with this is the Schistosomiasis hematobitum. And the fisherman present with a complaint of the weakness and the early fatigue. He used to have only the fish and the rice in diet. His baseline showed the HB 7.8, MCV 105. What could be the most likely cause is the डायफाइलोबोथ्रम लेटम. ठीक है, इसमें वीकनेस है, अर्ली फटीग है, और ये फिश के अंदर होता है डायफाइलोबोथ्रम. ओके, सो फिशर में एनीमिया रेज MCV है, B12 की डेफिशिएंसी से होता है. पेशेंट वाज हैविंग द अल्टर रेज टू माइक्रोसिटिक हाइपोक्रोमिक एनीमिया. स्टूल पे एग मिलेंगे विच जो कि रिस्पॉन्सिबल होते हैं फॉर द एंसाइलोस्टोमा ड्यूटेनल. ठीक है, माइक्रोस्टोमा इसकी वजह से होगा. सिस्टोसर्कोसिस कॉज बाय विच ऑफ द फॉलोइंग इजेशन ऑफ द ओवा ऑफ द टीनिया सोलम. ह्यूमन इज द इंटरमीडिएट होस्ट फॉर द फॉलोइंग इज द हाइडेटेड disease. 20-year young boy presented with a fever, headache, vomiting. He is having the neck stiffness, automatostator, hallucination. Which among us the following is the Nigeria fovillari? Okay. In the hookworm infestation, the microscopic feature present on the peripheral blood slide will be the spectacle-shaped bilobe nuclei. Child with the rigor, chills, headache organism detected on the GEMSA as the Plasmodium falciparum. पिनवॉर्म इज़ कॉज बाय द इंजेक्शन ऑफ द एग ऑफ द लार्वा. राइगल जो हेडेक है और ये जिम्सा के ऊपर आपको क्या देखने को मिलेगा, प्लाज्मोडियम फल्सिपेरम. पिनवॉर्म जो है वो कॉज होता है बाय द इंजेक्शन ऑफ द एग ऑफ द लार्वा. 8-year old boy looking the pale with a history of the eating mud. He vomited 6-inch long worm come out of his nose. What could be the causative organism is the ascaris. Ascaris तो बहुत लंबा होता है. Which of the following spread by the mosquito bites is the फिलेरियसिस से होता है ना, ये मॉस्किटो बाइट से होता है. ब्रिटिश वुमन वेंट टू द थाईलैंड प्रेजेंटेड विद द फीवर, राइगर चीज, मोस्ट लाइकली सफरिंग फ्रॉम द हिज द मलेरिया. विच ऑफ द फॉलोइंग सेल्स आर फाउंड इन द पैरासिटिक इन्फेक्शन इज द इओसिनोफीलिया. पैरासिटिक में इओसिनोफिल है, बैक्टीरियल में न्यूट्रोफिल और वायरल में लिम्फोसाइट होते हैं. सोल्जर प्रेजेंट विद द 3-month हिस्ट्री ऑफ द फीवर, बायोलेटरल लिम्फेडिनोपैथी एंड द हेपाटोस्प्लेनोमेगैली, एनीमिया, फटीग. हिस्ट्री ऑफ द स्लीपिंग ऑन द फ्लोर एंड बिटन बाय द सम फिलाई, सो काला आजार. Taxi driver in the UAE for the 3 years now returned to the Pakistan working presented with a clinical feature fever, weight loss, anorexia, diarrhea, spleen. He is emaciated, has a jaundice and the generalized lymphadenopathy. But is the diagnosis is the AIDS. Cola color urine is always in the following in the Plasmodium falciparum. Which of the following drug is recommended for the treatment of the स्वेयर और मल्टी ड्रग रेजिस्टेंट. इसमें क्या होगा, आर्टेमेसिनिन. ठीक है, विच ऑफ द फॉलोइंग ड्रग इज फॉर द ट्रीटमेंट ऑफ द स्वेयर मल्टी ड्रग रेजिस्टेंट. Got it. A farmer present with a migrating linear lion on the foot is a cutaneous larva, and the pregnant lady having the cat as a pet is at the risk of the toxoplasmosis. Patient with the yellowish vaginal discharge and the motile trophozoite is the Trichomonas vaginalis. Toxoplasmosis is a parasite. Plasmodium falciparum is a unicellular amoeba. Okay, so dormant stage of the malaria is the हिप्नोज़ोइट. मलेरिया की जो डॉर्मेंट स्टेज होती है वो हिप्नोज़ोइट होती है. मलेरिया ह्यूमन बॉडी में स्पोरोसाइट के थ्रू आता है और जो लीवर में है वो मीरोज़ोइट में डिवाइड हो जाता है. मोस्ट सेंसिटिव टेस्ट फॉर द एमेबिक एक्सिस विल बी द सीरोलॉजी. एमेबिक एक्सिस को देखने के लिए सीरोलॉजी होता है. पायोजेनिक को देखने के लिए अल्ट्रासाउंड होता है. हाइड्रेटिक के लिए ग्लूटिनेशन टेस्ट होता है. मैलिग्नेंट टर्शन जो मलेरिया होता है ये क्या कॉज करता है इज द फैल्सीपेरम. Okay, so malaria is transferred to the human blood in the form of the sporozoite. Plasmodium falciparum is feature is the black water fever. Patient came with a tender right hypochondrium swelling with occult blood on the colonoscopy. Ascending colon was involved, showing the ulcer while other parts of the colon were spared on the histology microscopy. What will be the Entamoeba histolytica? 29-year-old went remote areas developed the milk watery diarrhea for the one Peak occult blood diaries or after the 2 week courses will be the rotavirus. Watery diarrhea. Okay, so malaria is associated with a hemolytic anemia. Azad, 2-year-old boy from the Azad community with the failure to thrive from the 6 month comes with hepatosplenomegaly and the pallor, plus pancytopenia and the ESR80, and the diagnosis is a visceral leishmaniasis. Okay, infant diagnosed with a worm infestation, then the CBC, which of the following will confirm the diagnosis? The eosinophilia. Brucellosis is transmitted by the raw milk, and the parasite rate is calculated for which age group is a less than 5 year. Rectal biopsy done. How to diagnose the amoebic infection is the PES. Okay, and the patient with the dyspnea, fatigue, and dysphagia and the stool contain the egg and the labs HB on the 6. What is the cause? Is the hookworm. Pear-shaped egg and causing the diarrhea belonging to the giardia, and the क्वार्टन malaria is caused by the malaria. ठीक है, क्वार्टन जो है इसके थ्रू होता है. लॉन्गेस्ट प्रो एरिथ्रोस्टेटिक फेज इज द मलेरिया. शॉर्टेस्ट फ्री जो होती है वो होती है फॉल्सिवेरम की, और जो लॉन्गेस्ट होती है मलेरिया की. क्रॉनिक डायरिया नॉट रिस्पॉन्डिंग टू एंटीबायोटिक. क्रिसेंट शेप ऑर्गेनिज्म है, तो किस में होता है? जार्डिया में. Okay, patient after ingesting the some mix of the worm now present with the respiratory system organism is the Ascaris. Patient is a ring-like lesion, rashes on the forearm. Which one of the following is responsible? Is the deer tick. Which of the following spread by eating the raw and the undercooked meat is the tapeworm. Parasitic rate in the blood is calculated in which age? Is the below the 5 year. Acute cholangiopathis is caused by which of the following? Is the cholinergic sinensis. Patient presented with abdominal and the pelvic pain. Upon taking history, IUCD was implanted. What causative organism has caused this complication is the actinomycetes. Patient presented with a high-grade fever with the rigor chills for 2 days, 105 pulse, BP 110/80. Dark color urine like cause is the cerebral malaria. Middle-aged man living nearby a river gets blind due to is the onchorosis volvulus. Treatment of the Plasmodium vivax is the chloroquine. CT brain of the patient shows the cyst with a multiple daughter cyst. Which of the following is responsible for the tinea echinococcus? Okay, and the neurocysticercosis caused by the tinea solium. Cystostoma caused by which of the following is a urinary bladder infection? Parasite live in which of the following system is the lymphatics? Okay, drug of choice of the tapeworm is the niclosamide. And the middle-aged man living nearby the river gets blind due to the onchorosis volvulus. Treatment of the Plasmodium vivax is the chloroquine. I think so. We already discussed all of this. Immunocompromised patient with a profuse diarrhea, and strange or the oocyst 4 to 6 centimeter cause the cryptosporidiasis. Spodium parvorum cystomyosis. Which one of the following complication is the splenomegaly? Malaria enter into the human body is the sporozoites. Malignant quartan malaria is caused by the malaria. So myiasis of the nose caused by the larva fly, and the young girl uses a contact lenses present to OPD with the redness and the itchy eye. Her cornea is inflamed and contact lenses water sent for the culture. Which organism is the cause of her infection? Is the acanthamoeba. Okay, so a younger group of the boys living in the daycare surface, all of them are having the malaise and the weakness and the restlessness during the night. They cannot properly sleep due to the perianal itching. What is the cause of this system? Is the Antrobius vermicularis. Rectal prolapse में टी याद रखो, और anal itching में Antrobius vermicularis. Female has a vagina infection as an organism isolated with a jerky movement, which is a trichomonas. Woman present with a high grade fever with the chills and the cola color urine. Test reveal the crescent shape is a giardiasis. सॉरी, उसमें हाई ग्रेड फीवर है, कोला कलर सरफेस है, तो इसमें क्या होगा? Plasmodium falciparum. Man swimming in the freshwater pool died after the fireplace, but as a Naegleria fovulari ये brain का करता है. ठीक है. Lady with the pallor and the weakness on examination, low MCV, taste changes, and the X-stool diagnosis is the ancylostoma duodenale. Female came back from the Thailand with the fever and the chill and the body ache. Postural hypertension labs show the deranged RFTs and low HB and the WBCs and the platelets. What is the most suitable cause? Is the malaria. Okay, and the cholangiocarcinoma is caused by which of the following? Is the clonorchis senesis. A person went to Thailand and one returned with the diarrhea, which is watery and the large and amount in the stool. Donut shaped cyst cryptosporidiasis. What type of the cell increase in the parasitic infection? Is the eosinophil. Patient eating daily from the street vendor hospitalized for 2 weeks and a week infection reaches lung via the direct extension from the liver. Plasmodium falciparum is a unicellular amoeba. Okay, so female with a multiple sexual partner develop the vagina irritation in the pus. Jerky movements जो हैं वो किसकी होंगे is a trichomonas vaginalis की. Urinary abnormalities is associated with the schistosomiasis. Eating raw meat may transfer the tinea solium. Patient has presented with a history of the unconsciousness, fits, high-grade fever, and the dark-colored urine as the cerebral malaria. Thailand now came to the Pakistan presented with a fever, chest, body ache, confusion, and the postural hypertension is the malaria. Okay, with the parasitic infection, the respiratory symptoms are the pseudomoniasis. A lady visited Thailand and now came to presented with a fever, chest, body ache, confusion, and the postural hypertension. What is the most probable is the malaria, in which parasitic infection the respiratory system predominates is caries. Fisherman presented इसमें आपको मैंने क्या बताया था vitamin C. Okay, and next fisherman with anemia ecchymosis vitamin C है. Fisherman with anemia B12 की deficiency होती है. प्लस एकेमोसिस होगा तो विटामिन सी, अनीमिया होगा तो B12 और डाइफाइलोपैथी. ईटिंग रॉ इज अंडरकुक मीट कॉजिंग द इन्फेक्शन इज द tapeworm. HIV patient who immunocompromised with a profuse diarrhea, Z stain show the oocyst and the 6 centimeter cause is the cryptosporidium. 8-year-old boy used to eat the mud. Vomiting has a respiratory symptom and 6-inch long ascaris है. उसके बाद linearly and on the foot is the cutaneous larva migraines है. Schistosomiasis cause which of the following is the urinary bladder infection? Comb infection. The microscopic feature present on the peripheral blood slide will be the spectacle shape. The bilobe nuclear cysticercosis caused by which of these is the ingestion of the ova of the tinea solium? And the human is the intermediate host for which of the following is the hydrated cyst disease? Okay, and drug of choice for the tapeworm is the praziquantel. Soldier present with a 3 months history of the fever, bilateral lymphadenopathy, and the hepatosplenomegaly, anemia, fatigue, history of the sleeping on the floor, bitten by the sunfly, diagnosis the kala azar, क्वार्टन मलेरिया का मैंने आपको बताया था, मलेरिया प्लाज्मोडियम मलेरिया याद रखोगे. ठीक है, उसके बाद पैरोक्सिमल फीवर, चेस्ट, टाइम ड्यूरेशन है इसमें. वो क्रीसेंट शेप जो होती है वो किस वजह से है? फाल्सीपेरम की वजह से. इफ़ यू हैव एनी क्वेश्चन यू कैन आस्क.